there's everybody, this is Chris Peltier. I'm the president-elect of the chapter. I'm a general pediatrician in Cincinnati. And really, just first off, I want to thank many of you. I know during a lot of the COVID bills that Melissa mentioned, many of you I know at my home institution in Cincinnati, as well as I know some of the other children's hospitals, you all sent testimony in, so we really appreciate that. This is just a slide for the peds on call that was mentioned in both the chat box as well as Melissa mentioning it. And there's a QR code there that you can take a picture of if you are not already signed up. This is an easy way to do it. And it's really sort of the easiest way. The chapter makes it really easy. They will send you template letters. We will give you phone numbers of your legislators. It's very easy to do. And speaking of the chat box, 2 comments. If you have questions, please put them in the chat box. And also, if you wouldn't mind just putting your name in the chat box as well as which institution you're from, just so we have a good sense of our audience. Next slide, Liz. And then Melissa had mentioned our Ohio Champions for Vaccines. We actually have a Ohio Champions for Vaccines t-shirt. I'm going to model mine right there. This was really just a way to sort of market our rebranding of this to help spread the word that, of course, vaccines are safe and effective and necessary, obviously, not only to end COVID-19 pandemic, but obviously keeping all of our children safe. So we are selling those for the chapter. They're $25 and include shipping. And again, there's information on our website, which I'm going to show you. Liz, next slide.
And just before you go on, Chris, I have offered to purchase a t-shirt for those who attend the meeting that are residents tomorrow or Saturday.
Thank you very much, Dr. Fitch. So Dr. Fitch will work with you to get a t-shirt. That is fantastic. Thanks, Jill. And then this is just another slide with a QR code to get more information on Ohio Champions for Vaccines. And I will say, I put in the chat box, we are on social media, both Ohio AAP at OH Pediatricians, as well as Ohio Champions for Vaccines has their own Twitter handle, and they are actually verified by Twitter, which happened a few weeks ago. So very, very nice. Next slide. So speaking of our website, some of you may have gone to our website, and while our website definitely had a lot of information, the chapters over the years gotten feedback that it is not often the most user-friendly, easiest website to navigate. So after many, many months of hard work from our chapter staff, we now have a new website. It is still the same URL, so ohioaap.org. But it really has sort of a whole new look. We've brightened it up. We've hopefully made navigating the website much easier. We've refined some of the search functions, easy to find resources, and hopefully you all will agree that it has a little bit of a sleeker new look. There's a QR code also at the bottom of that screen. So just thank you to the staff and to Crowd Communications who helped us with literally this undertaking that's been going on for quite some time. We also have lots of information about all of our programs, which I'm going to briefly mention in a couple of slides. Advocacy updates that Melissa had mentioned, breaking news, our events like our annual meeting tomorrow, some of our fundraisers like Goofy Golf and Glow Ball that we do in the spring, as well as some other fundraising events. Next slide. And I will say just one last comment about our website. If anybody has any comments, many of you are much more tech savvy than some of our more senior members, which I unfortunately now am a member of, I think. Please give us feedback to the chapter, to Liz Dawson, who's our COO, and we would love to continue to update our website. Wanted to make a comment about diversity, equity, and inclusion, which I'm sure all of you are working through at your own institutions and within your programs. But the chapter has also embarked over the last year, really critically looking at our diversity, equity, inclusions. We know that raising healthy children in Ohio is a priority of the chapter and of you all. And as child advocates, we really aim to be that voice for children, as well as communities whose voices may not otherwise be heard. And as you know, equity and inclusion are not just simply words, but they have to be demonstrated through our actions as a chapter. And while many of our programs through the years have focused on diverse populations, including infant mortality prevention, lead screening and population health, really focus, those programs have traditionally focused on the needs of the underserved and marginalized communities. We really want to extend that sort of explicit effort and transparency that we're really looking to weave diversity, equity, inclusion into the fabric of all of our programs and our operations. Next slide. So as a result of this, we did a few things. Number one, the board created a diversity, equity, and inclusion statement that the board voted on and was published. We also commit as an organization that we really strive to educate our almost 3,000 members on identifying and mitigating implicit bias and being anti-racist in both professional and personal settings. And then really looking at our QI programs such as these and highlighting the data that we've been able to gather from doing these QI programs and really looking at how they relate to areas of underserved neighborhoods and integrating families into each of these programs to guarantee a better and more equitable perspective and outcome and really approach to the children that we serve in our programs. So it's not only just looking at the programs that we take part in and that we present, but it's also looking at the leadership of those programs. So looking for more diversity in our medical directors and then in our leadership as well. We've really made a conscious effort to reach out to include more diversity in our leaders, our pillar leaders, and our board. We really want the chapter to be a resource for families and empower them to have meaningful conversations, around many of the unfortunate current events that relate to racism and social determinants of health, and really try to mitigate the traumatic impact that these have had on our families. Obviously, the chapter advocacy is a key component, as Melissa talked about, and we really want to continue advocating at both the state and national levels to combat the crisis of racism in healthcare. And then really, again, just weaving this into all of our pillars and our programs. And so again, if you are interested in being involved, and we would love, and we're always looking to ways that we can increase diversity, equity, inclusion in the chapter. So we really look to you as we try to move forward this. So if you have if you have an interest in joining some of these efforts or you have ideas, please contact Melissa Rvu, our CEO here at the chapter office. Just wanted to make a brief mention about some of the QI programs. Can I have you go back one slide really quick, Liz? Thank you. So one of the other big things that we do in the Ohio AAP is quality improvement programs. So these are a couple of some of the amazing programs that we have next year. So we are currently recruiting for participants in HPV, vaccine program, suicide prevention, interconceptional care, smoking cessation, and preschool vision screening. And next slide, please. And while we know as residents that it's sometimes difficult at your continuity clinic, to do these QI programs, I encourage you to talk to your medical staff at your QI or at your continuity clinic residents to see if you can incorporate these into your training. We also have several educational programs focused on lead prevention, pediatric JIA, and nutrition and exercise that don't involve as much QI. So please check those out on our website. Next slide. And of course, follow us on social media, and there's all the ways you can interact with us. Next slide. And I think that's just sort of a summary of everything that sort of our ask of you is ways to get involved. Next slide. So it's now my pleasure, and I'm very excited to introduce our final speaker and a member of our Ohio AAP Foundation Advisory Board, Nita Garg. Ms. Garg focuses her practice on assisting clients with healthcare issues, including those related to fraud and abuse, HIPAA compliance, and employee agreements. Ms. Garg also has experience in healthcare litigation. She also counsels clients on privacy matters related to HIPAA, FERPA, and GDPR, which when you're in practice, you will learn what all those acronyms mean. She assists clients on both the front end of privacy compliance, such as drafting policies and employee training, and on the back end with breach response. She's a certified information privacy professional and a frequent writer on developments in domestic and international privacy. And it's now my pleasure to turn the presentation over to our featured speaker, Nita Garg, an associate with Voorhees. Nita, welcome.
Thank you so much, Chris, for that wonderful introduction. And thank you so much for all of the residents and fellows taking time out of your incredibly busy schedule to focus on this. My husband's a surgeon, pediatric surgeon, my sister's a doctor, everyone in my family is a physician. And I feel like in medical school and residency and fellowship, you often are taught how to practice medicine, but not necessarily the legal and business aspects of practicing medicine. And so I think it's very important. I'm really glad you guys are kind of dipping your toe into the water of what you need to know with regard to your employment agreement. Next slide, please. So the first thing that you need to consider when you're contemplating your first employment agreement or several job offers that you're receiving is what is the environment? Before soliciting a contract for employment, consider what kind of practice would best suit your needs and preferences. So for example, are you someone who wants to work in an academic medical center? Are you someone who is wanting to work in private practice? Oh, sorry, I didn't realize my video wasn't on. Are you someone who is wanting to work in a small practice? Are you someone wanting to work in a small practice? Do you want to work for the VA? Are you wanting to work for the Indian Health Service? So that's something you really need to consider before you start interviewing and soliciting employment offers. Each practice, and that's important because each practice will have a different culture and environment, also different compensation as well. And know that these cultural differences can potentially influence the scope and formality of the contract that you're offered. For example, the hospital will likely have a formal template, and negotiating for better or different terms be pretty difficult. Although if you're in a hospital rural area, you may have better chance for leverage. If you're at a small practice, you probably have a better chance of getting any changes made, and especially if you're a rural or underserved area where the practice has a difficult time recruiting physicians, you'll probably have better leverage. Next slide, please. So negotiation strategies. It's important that you consider the stage at which you're negotiating. Are you at the employment agreement / independent contract agreement stage, or does the employer want to start with a letter of intent? There's no right or wrong way to begin, but it's important to know that if you start with a letter of intent, you need to take note of whether it's binding or non-binding. So essentially, is whatever the terms of that letter of intent say, that sticks, or it's just, hey, let's just hash out a summary of things we plan on discussing. So you'll be obligated, and does the letter of intent say that you're obligated to exclusively negotiate with the practice? Does that mean that you can't consider other employment offers at the same time? Whatever stage you're at, make sure and insist that the terms of the agreement or letter of intent reflect what was discussed in your negotiations and conversations with the employer. Remember that while you may have heard what terms are in your attendings contracts or other people's contracts throughout residency or fellowship, you are new to the field. It may not seem like it after 4 years of medical school. Some of you did, a master's or PhD, and then anywhere from, 3 to 7 years of training after. But you are just starting out, and so you don't have a long list of patients. You don't have the same community reference referrals to things like that. That means your bargaining position is relatively low, but it'll increase with your years of experience. At this point, though, you really need to weigh what you want versus what is acceptable. As we talk about the standard terms you see in contracts, you'll want to rank what you want versus what you can live with until your bargaining position is stronger. As you go back and forth with your counterpoint on the terms, always remember to remain respectful and show deference during the negotiations. The physician community is incredibly small. I'm sure you all know that already, and people talk. It's one thing to engage in friendly negotiations and ask for, make requests that result in an offer you turn down because it doesn't meet your needs. But you don't want to be the person who doesn't get an offer because you were unreasonably difficult during negotiations. Next slide, please. So what are some clauses to note? So this slide lists a few clauses that we commonly see in contracts, and I'm just going to give you a brief explanation. So, and then I'll go into deeper explanation of other provisions. So start date versus effective date. The start date is the date you physically show up to provide professional services. And the effective date could either be your start date, or it could just be the day the contract is executed between you and your employer. It's important because it can impact the timing of other clauses. So when does the term of employment begin? Is it the start date or the effective date? It also can affect when you can terminate, restrictive covenants, things like that. This difference is most important at this stage in your career because many of you will sign employment agreements potentially a year or two in advance. Some of you may have, potential offers where they say, hey, sign this year in advance, we'll give you a stipend, etc. So it is important to note start date versus effective date. Confidentiality. This will likely require you to keep all terms of the contract confidential, which usually applies whether you relay the terms by showing someone the physical contract or by telling your friend the contents. If it's more broadly drafted, it can also include keeping confidential all patient lists, policies, procedures, trade secrets, business operations, etc. Totally typical and expected. Exclusive negotiations. This is an important one, but is typically reserved to letters of intent. And as I mentioned, some letters of intent may require that you only negotiate with one party, which prevents you from starting a bidding war between two parties for your services. It can be present in employment agreements as well, especially if the effective date is the execution date of the contract. So that means if you sign the employment agreement, you can't negotiate with another party in hopes of getting a better deal before your start date. Indemnification, it essentially means that you would cover your employer for any of your negligence, fraudulent billing and coding, and your employer gets dinged by a third party because you did something wrong. So that's something that you keep in mind. If you can negotiate around that, I would recommend doing so. But at least if it's narrowed to, hey, if you did something through your fault and the employer is on the hook, they may require that you pay them back essentially. Medical records completion, I'm sure you're well aware through residency and fellowship, it's clause pretty self-explanatory. Your employer is going to require your charts to be completed within a certain time frame, usually dependent on, payer timelines, and not adhering to that can result in withholding of compensation, potentially not being bonus eligible, etc. So what is a breach? A breach can be defined very broadly. For example, any failure to satisfy an obligation owed under the contract, or narrowly, the contract may say only, this laundry list of 5 actions would be considered a breach. Usually an agreement has what's referred to in legal terms as a cure period. And a cure period is the time in which the party who has allegedly breached the agreement has time to rectify their mistake and fix it. So, hey, this is considered a breach unless you fix the issue in, for example, 30 days. Things get interesting when the breach is, such a nature that can't be inherently cured. So for example, sexual harassment, you can't really have a cure period for that. You sexually harassed someone and that's a breach of the agreement. There's not a cure period. Dispute resolution. This is a clause that requires disputes between you and your employer to be discussed or settled through mediation or arbitration. Usually, and then they'll make reference to which party pays for the arbitration costs. Next slide, please. So what are the pertinent clauses we're going to discuss today? These are the ones that I think you guys are most interested in. So comp and benefits, outside activities, also known as side hustles, job description and requirements, call coverage, restrictive covenants, length of term, termination options, and then gap and tail insurance. So compensation. Right out of residency and fellowship, you'll typically be offered a salary guarantee. Some of you may be offered an Rvu based compensation for at least, but most of you will receive a base guaranteed salary for a year or two. It's rare to see physicians operate on a revenue minus expense model because you're building your practice from the ground up. I have had a client he's an orthopedic surgeon, and I think he specialized in trauma surgery, but that was what he wanted. It was an eat what you kill model. But most of you will see, hey, here's a guaranteed base salary for 1 to 2 years. You might also see a bonus built into your compensation model, and it's a way to incentivize good citizenship, practice efficiencies, and productivity, most importantly. Additionally, you could also see a sum of money being offered towards your student loans. It's often offered as a loan, not a bonus, and it comes with strings attached. So they can either pay this amount all at once, or they could pay in installments. The employer typically makes you sign a promissory note, which is a contract saying that, hey, in return for a lump sum, You agree to stay employed with this practice for X number of years, and for each month you stay, an equal portion of your obligation to pay the money back is forgiven. If you leave early in that situation, it's likely that some of the money would be forgiven, but you'd have to repay the rest of it. And it often is due immediately. It's referred to as an acceleration clause. So you could have a decent chunk of money due immediately and potentially with interest. When an employer offers you as far as salary, it's somewhat difficult to negotiate higher. Again, it depends on what your leverage is, how specialized is your practice, how difficult of a location is it for the practice to find physicians. So for example, if you are in Columbus proper, that tends to be a much more saturated market. If you're willing to move to a more rural area, you may have more leverage because they may have a difficult time finding physicians, and especially younger physicians are more likely wanting to live in urban areas. And so, for example, my sister and her husband practice in Sioux Falls, South Dakota. They have no connections there, but they work for a hospital system that had a really hard time recruiting physicians. And so they had much more leverage when it came to negotiating their employment agreements. Sorry, 1 second. Outside activity, so that's something that you need to consider as well. There's also other compensation and benefits like signing bonus, medical director agreements. Call coverage could potentially be paid, not always. You could have a benefit in that there's not a restrictive covenant. They could offer a teaching stipend. They could pay for moving expenses, etc. So that's all part of the total compensation package. Next slide, please. Apologies, I should have done that one earlier. Next slide. Okay, so this is just an example of a salary guarantee. It basically says from the start date for the first year, unless the agreement's terminated earlier, you're paid X amount of money. Next slide. So this is an example of RVU-based compensation. So you see it's based on productivity. They set a rate of X number of dollars per RVU. They estimate a production number, and then you're paid based on that. If you end up producing more RVUs, they may pay you more money. And if you end up not reaching that RVU number, they may say, hey, you owe us money so we can reconcile the discrepancy. So just something to keep in mind. But again, that's not typical to see for the first year or two after residency or fellowship. Next slide. Bonus language. This is, typical bonus language. Hey, here it's based on RVUs. But this would be, language like this would be if you had a base guarantee model, and then you would have bonus based on productivity. Note that you can't be paid twice for the same work. So language like this wouldn't work if you had a base salary. If the base salary was productivity model. There are lots of different ways to calculate bonuses, lots of different ways to pay it. This is just an example. Next slide, please. Here's some sample language of what you might expect with loan forgiveness. Essentially says, hey, we'll advance you as a loan this amount of money, and then you will repay in equal monthly installments, but we'll forgive it for every month you're employed here. So that's something to keep in mind as well. If that forgiveness period, takes 3 years, you may think that you're committed to that employer for 3 years. You're not necessarily, but you are committed to paying back that money if you don't stay there for 3 years. Next slide, please. So outside activity. At this stage in your career, most of your employers are going to want 100% of your time. So they limit your ability to engage in outside activities, or they may limit your ability to retain the money you receive for outside activities. These activities can be volunteering your medical services, working with pharmaceutical or medical device companies, giving speeches, having a separate company, trying to moonlight, etc. Whether this is important to you to have an outside activity varies from individuals. Some people say, I want my one job and I'm done. Some people are very entrepreneurial, or some people say, I have a lot of loans. I want to just make as much money as possible. So if it is something that's important to you, you need to read your contract clearly to see whether or not it prohibits you from engaging in outside activities, or requires you to submit any money you made, or requires prior written approval. What I recommend for physicians who are wanting to engage in an outside activity and they're in the middle of negotiating their contract is, as part of the contract, write in, employer agrees that prior written approval is given to, and insert whatever activities you're wanting to include in your outside activities. And one thing to note with volunteer, usually they won't prohibit you from engaging in volunteer medical services, but your medical malpractice through your employer would not necessarily apply. So that's something to keep in mind as well. Your medical malpractice insurance would be limited to the services you provide for your employer. And so any activities outside of that would be subject to additional malpractice coverage or need separate malpractice coverage. Next slide, please. Okay, so job description requirements, it's a simple concept that you want to make sure the agreement does what you think you're supposed to be doing under the role, and it's reflected in this job description. So for example, if you split your time 50-50 between clinical and research duties, make sure that's in writing. If you plan on doing research and you're expecting funding for that, make sure that's included in writing. A job description can be as broad and narrow as desired, but if you were not anticipating engaging in teaching, make sure that's not in your job description. If you would like to, if you plan on serving as a medical director, make sure that's included in there. So just make sure that whatever description of the job is included, it matches your expectations. Next slide, please. Call coverage. So if you're offered additional payment for call coverage, negotiate, it's important you negotiate the time expectations, exclusivity, and payment terms. Is it 24-hour coverage? Is it a week? Do you have to be immediately available? Or is this, home call? Do you just need to be a phone call away, but not go in? Are you expected to be 15 minutes within the site of the hospital? Are you sharing coverage, or are you able to get exclusivity? How is the schedule determined? Is it evenly distributed among all of your colleagues, or is there a seniority component? Can you take call at other healthcare providers for moonlighting? And then also, I've seen in contracts where the contract requires that the physician pay for backup if they have a conflict or vacation. And so that's something to keep in mind as well. Next slide, please. So restrictive covenants. In the context of an employment agreement, a restrictive covenant is basically a provision in your agreement that says it restricts your ability to work somewhere else or solicit former employees, in a nutshell. So next slide. So there's two main restrictive covenants. One's a non-compete, which is the one that you've probably heard about more and you're likely going to be more concerned with. And the second is a non-solicitation. So for the dreaded non-compete, look at when it's triggered. Just when you terminate the contract without cause, if it's regardless of why the contract's terminated. If the contract expires and no one terminated it, it's just a 3-year term and it ends at 3 years, is it still triggered? You shouldn't have a non-compete enforced against you if you have to terminate the agreement for cause. So if the employer, breaches the agreement, it's not fair for you to be subject to a non-compete. So we try to add language in that says, it's not already in there, that if the employer breaches in the agreement and you terminate because the employer breached, you shouldn't have to be held liable to comply with the restrictive covenant. Look to see how long it lasts. We typically see 1 to 2 years. What's the geographical scope? Is it, 5 miles from where you practice? Is it 10 miles from every location the employer has? And if it's a large employer, that could be potentially burdensome. I know that not all of you are going to practice in Ohio. For example, Texas has incredibly restrictive covenants. It's a very employer-friendly state, and Texas Children's Hospital has a 40-mile non-compete. That's completely fine, and they've got the ability to do that, and so that restricts you essentially from the Houston Metroplex from practicing. See what you can negotiate, if you can negotiate down the duration and the geographic scope of your non-compete. But if you're someone who knows you don't plan on practicing in that area after, don't make a mountain out of a molehill and just let it be. So if you're saying, hey, I'm only practicing here for 3 years, once my contract's over, I don't plan on being in the city, then you don't need to worry about this. There's also non-solicitation. So there'll be a provision for, same amount of time that says, hey, you can't take patients of this practice, you can't take staff, because their concern is that you're going to compete with them in taking their business and taking their best employees and cherry picking. Next slide, please. So length of term, this is pretty simple concept, but it's important to know how term is defined. So typically you see initial terms anywhere from 1 to 3 years is what we see for first agreements. And then it's separated from subsequent terms that are renewal terms. So it'll say, hey, this term begins on this date, 2017, and it ends a year later, and then it will automatically renew for 1 year periods unless either party terminates. We just want you to know, what's important to know is if there's an automatic renewal and you don't intend to renew, you need to make sure you notify the employer with advance notice that you don't intend to renew, because otherwise it'll automatically go into another year. Next slide, please. So termination. You want to make sure there's an out from your contract. What seems reasonable and great now may not materialize when you get there. It may not be the culture you expect. It may not be the colleagues or the workload that you're expecting, either too busy or not busy enough. Without cause provisions would allow either party to walk away with just a notice period. So hey, either of you can terminate as long as you give, for example, 90 days prior written notice. Remember to check what other clauses are affected if you exercise that without cause termination. As I mentioned earlier, the non-compete. Terminating with cause means essentially someone screwed up, and that screw up is the reason the contract is being terminated. It's common for employers to specify that they have the option to terminate with cause, but they often don't want to, they don't spell out what constitutes cause, and they often don't include language that says you can terminate with cause. So to the extent possible, we like to add that language in. Something else to note is most states, including Ohio, have a requirement that physicians can't need to provide notice to patients if they leave. So in Ohio, there's a statutory requirement that the employer send a notice letter to your patients within 30 days of your employment relationship ending. The employer can waive this obligation and give it to the physician. If the employer retains the obligation, it's to your benefit to make sure that the contract lets you look at that notice prior to it being sent out. You mutually agree upon the writing. That gives you control of the message and prevents any, snarky comments if the relationship's ending poorly. If you do send it yourself, you have to pay for it, and the cost can add up depending on how many patients you see, because it's usually you need to send it to patients you've seen in the past year or whatever, which could be quite a few. Next slide, please. So gap and tail insurance. If you're employed, the employer almost always pays for your malpractice insurance unless you're in a eat what you kill, you pay all your expenses, but you keep all the revenues model, which again is going to be very rare. Malpractice insurance can either be claims made or occurrence-based. So occurrence-based malpractice insurance means neither you or your employer will be required to pay for tail when you leave. If it's claims, then a tail is necessary, so occurrence-based insurance covers any activity that happened during the term of that coverage. Claims-based only covers claims that were made during that period. So if you have a claim that was made for an incident that occurred during that period, but you have claims-based coverage, that's why you need tail insurance. It can be quite pricey, which is why employers will try to push it off on employees. To the extent possible, we recommend that you negotiate that the employer has to pay for tail insurance, just because it can be incredibly pricey, and your next employment agreement will say you need to have tail insurance from your previous employment. You don't need to worry about tail insurance from residency and fellowship. You're covered from any of your training programs, so you don't need to go into your first agreement with tail insurance. Next slide, please. So why does negotiation matter? Why is this so important? So remember, your bargaining position now may be relatively weak, but you'll make a dramatic jump in the next few years. So don't make your goal with negotiation now to win on everything. As I mentioned earlier, focus on what your absolute deal breaker needs are versus what you want. And that could be, hey, I need to be in this certain city because that's where my family is. And if that's the case, then you can't get, the salary, necessarily get the salary you want, the benefits you want, the hours you want, et cetera. So what's most important to you? Is it location? Is it compensation? Is it the type of institution you're working? Is it having research versus clinical time? Really figure out what you're needing most, and shoot for a mutual fair deal between both parties. It's much more beneficial in the long term and will make the employer eager to work with you and excited to have you. And as you gain experience and reputation, your negotiating power will increase. But don't minimize the importance of your contract or negotiations. When you're recruited, you're talking with your colleagues and everyone's nice and friendly and amicable. And there's an enormous sense of like, trust me, it'll all work out. We're doctors, blah, blah, blah. But if it's not written in the contract, it doesn't exist. I don't care what they texted you, what they emailed you, what they told you in your interview, what they said over drinks and dinner. If it is not written in the four corners of that contract, it is irrelevant, because contracts typically have a line that says something to the effect of, anything not included in this contract is not agreed to. So if you agree to it with a handshake, doesn't matter, put it in the contract. Remember, you're hired by doctors, but you're fired by lawyers, which is, it's cynical, but it's true. So you want to make sure your contract is legally buttoned up on the front end, and then you stand a better chance of leaving on good terms. Next slide, please. So tips for success. Credentialing packet, fill it out on time. That can take an incredible amount of time. Same with if you're applying for licensure, especially with COVID, a lot of states are backed up. So we recommend doing that as timely as possible. Be responsive with to administrators and staff reaching out to you with questions. Also, you ask questions. Don't assume anything. It is okay. There are no stupid questions. Ask the staff, ask the admin. Make sure that all of your concerns are addressed. Read the paperwork. Be proactive. Don't disparage anyone. Don't disparage your medical school, your fellowship program, your training program, your residency, former colleagues, because that can reflect poorly on you. Attend any meetings you're invited to, and hire a healthcare lawyer. Even in the situations where you may not have the leverage to negotiate, I think it's still incredibly important that you understand what you are agreeing to and what you were signing on to. You may not be able to change it, but it may give you pause as to whether or not this is the right practice for you. If it's got, an incredible restrictive covenant, or the compensation model doesn't work for you. So just make sure you speak with a lawyer who can decode all of the legalese and explain that to you. And with that, I will leave it to a couple of questions. Let me see. I don't know. Let me review the chat. Sorry, 1 second. Yeah, agreed, Chris. That's the total package. It's boards, licensure, what associations, do you have a CLE fund? What are your benefits in terms of time off? All important things to consider. Yes, I definitely agree, Jill. You absolutely need to have a lawyer review the contract. I also recommend, one thing I didn't mention is it's important to look at what is the turnover in this practice. Is this the kind of practice where you're seeing physicians who've been there 10, 15, 20 years? Or are you seeing a practice where you've got the partners who've been there for 30 years and then the fresh meat is being rotated out every year or two? Because that also tells you a lot about the practice. So speak to people who are currently at the practice, speak to people if you know they've left the practice, speak to your colleagues to know what they know. For example, my sister interviewed at a practice in Dallas and then spoke to my husband's aunt, and she was like, it's awful, let me tell you the backstory. And she wouldn't have known that. So to the extent that you can, speak to your colleagues that you trust about the practice, because it is a big commitment. You've spent so much time training and you want to make sure you have the right fit.
Hey, Nita, before I let Dr. Fitch wrap us up, I want to make a comment, especially since we're kind of talking to mostly, obviously, residency programs. Even if you're looking, and I can speak from Cincinnati Children's, I think most children's hospitals have sort of the same setup, whether you're looking within your city, and I'm talking about private practice because that's the world I live in, or if you're looking at other cities, right? So contact, your chief residents can get you in contact with chief residents in other cities, as well as your program directors. Most children's hospitals have sort of a physician outreach and engagement team that I know in Cincinnati Children's, for instance, they keep a list of all of the practices that are currently hiring out in the community. Mm-hmm. And I help connect, I've actually just did that for a resident at Nationwide that's coming back to Cincinnati. And so reach out to your chiefs, your program directors. They can get you in touch with institutions at other cities if you're thinking about, if you're looking for jobs in other cities. So that's a great way to sort of get connected when you may not know anybody in a city.
Agreed. Well, thank you so much for your time today. I really appreciate it, everyone.
And thank you, everybody, for joining us today. Again, I think this is such an important talk that is, as Nita said, we don't get a lot of education in this, so it is incredibly important and obviously is the focus of the rest of your life. again, I am hoping that you will be able to attend our meeting over the next 2 days, and definitely look at the exhibit hall as well if you go ahead and sign up. And if you have any questions or concerns, let us know. We would love, again, no matter what your involvement is, and that could be anywhere from advocacy to education, writing an article here and there for our HIOPEDs. It could also be, and we forgot to put up a slide about our Goofy Golf, which was our foundation event this year. A couple of the residents from Nationwide Children's came, and it's a fun event, and it helps raise money for our different endeavors like Store It Safe. So thank you again for your time. I'm sorry we went a little bit over, but we had some technical problems early. And again, I look forward to seeing you over the next 2 days.